Hello everyone and welcome back to our channel Quaint. Today's topic of discussion is ectopic pregnancy dilemma. So suppose, just imagine a woman is experiencing severe pelvic pain and abnormal bleeding. So in that case, doctors suspect an ectopic pregnancy. Okay, doctors suspect an ectopic pregnancy. So the question is whether the pregnancy is viable or has already a miscarriage occurred. So there is a dilemma. You can see there is a dilemma. Doctors are not sure about the condition of the pregnancy and whether it is actually ectopic pregnancy or not. So many doubts are there, and these doubts, and the question is what? The questions are life-saving questions, because if really an ectopic pregnancy has occurred, that was not known before, so that is actually life-threatening. So that's why so many questions are there, and to answer to all these questions, one method is there, that is known as ultrasound. Not only ultrasound, but it is actually Doppler ultrasound. There is a difference between Doppler ultrasound and traditional ultrasound. There is a difference. So here in this case, what is the requirement? The requirement is Doppler ultrasound. So doctors must choose this technique. If they suspect a problem of ectopic pregnancy, okay, so what is the conclusion from here? So two things may exist. Either of two things may exist. One is the pregnancy is still live. Means it is still alive, the pregnancy. That is, it is still viable. Okay. And the next one is what? Miscarriage has already occurred. So how to detect this? For this purpose, the requirement is a Doppler ultrasound. Okay, so say for example the ectopic pregnancy exists and it is still alive. That means it is viable. So in that case, how doctors will be sure about this? So for this, Doppler ultrasound is recommended, and that is done. So on the monitor, doctors see what? Okay, they see if the ectopic pregnancy is still alive or it is still viable. In that case, they see a high velocity blood flow around the ectopic mass. Okay, actually the trophoblastic, in that case the trophoblastic tissue, okay, the trophoblastic tissues are still alive. Trophoblastic tissues means which forms the placenta. Those are still alive and there is blood flow. So high velocity blood flow is observed on the monitor. They see, the doctors can see a ring of fire sign on the screen, and that way they can be sure about the pregnancy, ectopic pregnancy. So first of all, let's discuss what is ectopic pregnancy. Pregnancy, you know, pregnancy occurs in the uterus. Okay, means the embryo develops in the uterus. It is implanted and develops in the uterus. But due to some problem, if pregnancy occurs outside the uterus, in that case, that kind of pregnancy is known as ectopic pregnancy. And in that case, in most of the cases, the other place is the fallopian tubes. Other place is the fallopian tube. In either in one of the tubes, two tubes are there, you know, fallopian tubes. So if the pregnancy occurs in the fallopian tube, so that is a kind of ectopic pregnancy. But the problem is that if the embryo implants inside the fallopian tube, in that case the fallopian tube cannot support the development or the growth of the embryo. because a required environment is not there inside the fallopian tube. So fallopian tube is unable to support the fertilized egg or the embryo. Okay, so that's why what is the requirement? Requirement is to terminate the pregnancy. Otherwise, that can be life-threatening for the patient, for the woman. Okay, so that's why termination is required. So if it is still alive, if the pregnancy is still viable, in that case, surgical removal may be necessary. Surgically, the ectopic mass need to be removed. In that case, a laparoscopic surgery is available. That technique may be followed by the doctors. Anyway, everything depends on the doctors. But before all these things, what is the requirement? Requirement is to ensure about the condition of the pregnancy, whether it is still viable or a miscarriage has already occurred. So suppose if the doctors find a high velocity flow around the ectopic mass, that means the pregnancy is still viable. In that case, medical or surgical intervention may be required. Medical or surgical intervention may be required. So say for example, no problem is there. So in that case, means no complications are there. In that case, a medication is there known as methotrexate medication, methotrexate injection that is given to the patient, and that stops the cell growth and dissolves the pregnancy. Okay, that dissolves the pregnancy. First, that injection stops the cell growth and therefore that dissolves the pregnancy. So that is what? That is a medication. Name is a methotrexate injection. So that is done when there are no complications. But if complications are there, everything depends on the doctors. Okay, if complications are there, if doctors find suitable to remove the ectopic mass by surgery, then they will do the same thing. It depends on the expertise of the doctors. So this was all about what? This was all about if the ectopic pregnancy is still viable. In that case, two options are there: medication or surgery. And the next one is what? Next one is miscarriage has already occurred. So in that case, if miscarriage has already occurred, in that case, how doctors will be sure about that miscarriage has already occurred? In that case, using Doppler ultrasound, in that case, they will find on the screen no blood flow or very less blood flow. Means they won't get high velocity blood flow. That means miscarriage has already occurred, or you can better you can analyze this way also. The embryo has stopped developing. Okay, it's a dead embryo. We can say also that way. It's a dead embryo. So again, there are two options. What to do in that case? If there are no complications in that case, okay, in that case, doctors may allow to resolve the issue naturally. Means in that case, the patient's body or the woman's body will resolve the issue naturally. Means in that case, that dead embryo will be absorbed by the body. And this is called, in terms of medical science, this is called expectant management. Expectant management. This term is used by the doctors or medical science, better to say medical sciences. So this is when this is allowed when there are no complications. Miscarriage has already occurred, but there are no complications. But if there are complications, means if retained tissue exists or still bleeding occurs after the miscarriage, in that case surgical intervention may be necessary. Okay, in that case, doctors choose laparoscopic surgery. Small holes, small incisions are made on the abdomen or the pelvis, and that way surgery is done. Okay, means this is actually a kind of a minimally invasive surgical procedure. So laparoscopic surgeries are done to remove the mass, ectopic mass, dead ectopic mass, because miscarriage has already occurred. That means it is now dead. So what you can see the importance of Doppler ultrasound. But if you do not use Doppler ultrasound to test these things, that means if you use only traditional Doppler, in that case you won't be able to see that ring of fire sign. Okay, ring of fire sign means that high velocity flow, if it exists, or miscarriage has already occurred, it is dead. These things are not clearly visible in case of a traditional Doppler. In case of a traditional ultrasound, but in case of only Doppler ultrasound, these things are clearly visible. Doctors can easily be sure about the patient's condition, and that after knowing the patient's condition, they can easily decide what to do with the patient. So for each case, if the pregnancy is viable, two options are there. If the pregnancy has already terminated, that means miscarriage has already occurred, again there are two options. And in all these cases, what is assisting them? The technology, Doppler ultrasound technology is assisting them to take the required or to take the accurate decision for the patient, because it is no doubt, means ectopic pregnancy, means suppose if ectopic pregnancy has already occurred and that is left untreated, in that case that can be proved to be life-threatening. Okay, that's why this is very important. So early recognition of this kind of pregnancy is required. Early recognition is required. As early as you can diagnose the condition, and accordingly you can, if you take the necessary action, then in that case you can easily save the life of the woman or the patient. Okay. Anyway, so this was all about. So that's why the title is given that way, that ectopic pregnancy dilemma. No doubt it's a case of dilemma. It's a dilemma. Anyway, so this was all about today's topic, and if you found this video to be informative, then please like, share and subscribe to our channel. So see you in the next video, and okay, so this is the end of this video. Thank you for watching this video.